Heart failure is a serious condition but often misunderstood. Many people think that heart failure means the heart stops beating, but in fact, it does not. Heart failure occurs when the heart muscle is weakened or damaged and can no longer pump blood effectively to the organs of the body. Poor blood circulation leads to fluid buildup, especially in the lungs and lower limbs, causing symptoms such as shortness of breath, fatigue, and leg swelling. You can imagine the heart as a pump. When healthy, it pumps blood strongly and regularly. But when weakened, that pump works sluggishly, without enough pressure, causing blood flow to become inefficient. As a result, the body does not receive enough oxygen and nutrients to maintain normal activities. Heart failure often progresses silently and can last for many years. Therefore, early recognition and timely treatment are key factors to help patients live longer, stay healthier, and reduce the risk of dangerous complications later on. Heart failure often progresses silently, causing many people to be complacent because they do not recognize the early signs. However, the body always sends out very clear distress signals if you pay attention. The most common symptom is shortness of breath. Patients feel breathless when walking, climbing stairs, or even when lying down to rest or while sleeping. They may have to sit up to breathe more easily. Swelling in the legs and ankles is also an important sign. When the heart cannot pump blood effectively, fluid builds up in the lower limbs, causing the legs to swell, especially in the afternoon. In addition, patients may experience persistent fatigue, rapid heartbeat, palpitations, dizziness, and unusually rapid weight gain over a few days due to fluid retention. These symptoms can easily be mistaken for aging or other illnesses. But if they occur frequently, especially in combination, you should not ignore them. Early detection of heart failure allows for more effective treatment and helps prevent dangerous complications such as acute heart failure or stroke. There are many causes of heart failure, but most are related to chronic cardiovascular conditions and unhealthy lifestyles. Prolonged high blood pressure is the most common cause. When blood pressure is high, the heart has to work harder to pump blood, and over time the heart muscle becomes weakened. Another cause is myocardial infarction, which occurs when the coronary arteries are blocked, leading to permanent damage in part of the heart and reduced function. In addition, heart valve disease, such as valve stenosis or regurgitation, causes abnormal blood flow, increasing the workload on the heart. Diabetes, obesity, smoking, excessive alcohol consumption, and physical inactivity are also major risk factors. In older adults, the natural aging of the heart muscle and blood vessels significantly increases the risk of heart failure, even without any clear underlying disease. Understanding the causes helps us prevent and manage the condition early, rather than waiting for symptoms to appear before seeking treatment. Although heart failure cannot be completely cured, if detected early and treated properly, patients can live healthily for many years. Treatment includes medication, lifestyle changes, and close monitoring of health status. Medication is the cornerstone of heart failure treatment. Commonly used drug groups include angiotensin-converting enzyme inhibitors, ACEI, beta blockers, diuretics, fluid retention-reducing medications, and more recently, SGLT2 inhibitors, which have shown significant effectiveness. These medications help the heart work more efficiently, reduce symptoms, and slow disease progression. In addition, lifestyle changes are essential, reducing salt intake, controlling daily fluid consumption, engaging in light exercises such as walking or yoga, and getting adequate rest. Patients should also monitor their weight daily. A gain of 1 to 2 kilograms over a few days may signal fluid retention. Avoiding smoking, limiting alcohol, and strictly following the treatment regimen can significantly improve quality of life. Heart failure can be a serious condition, but it does not mean the end of a healthy life. With medical advances and greater health awareness, patients can fully manage this condition and maintain an active, optimistic lifestyle. The key lies in early detection, proper treatment, and consistent follow-up. Every small lifestyle change, from reducing salt intake and drinking the right amount of water to walking daily, is a big step toward protecting the heart. Most importantly, patients need to closely cooperate with their doctors, avoid stopping or adjusting medications on their own, and report all symptoms they are experiencing. If you found this video helpful, please share it with your loved ones and friends, because your timely care could help someone live healthier and longer with a stronger heart. Thank you for watching. If you found this video meaningful, don't forget to like, share, and subscribe to support the channel.